Well, good morning, everyone. My name is Jenny Koltnow, and I'm the Director of Development and Communications at Church Health in Memphis. As I mentioned, it's an honor, but it's also humbling to speak with all of you because I, first of all, just admire everything that you're doing and the sacrifice and the passion that you put behind serving our underserved, but also because we're all making decisions and working on the fly in a way that probably most of us aren't used to doing. You know, coming into late February, early March, I know for Church Health, we had really, we're going gangbusters with events and strategies and roles for a development team that had been really evolving over the last few years, and then suddenly all bets are off and we have to shift this mode. Today, I welcome your questions. As I mentioned, if you didn't hear me say earlier, you can post them in the chat, but I'm happy to help or at least board in the weeks ahead. And I do think that collaboration and keeping an eye out and learning from each other. There's no pride of authorship here. We can hopefully continue to bring in resources, but also maintain relationships with those who have funded us and those who have yet to meet us. So to begin, I want to level set that there is a tremendous position of strength that all of you are standing in right now. You know, there has probably never been a time, at least as long as I've been in the world of philanthropy, where there's been such a magnification of the healthcare needs and the healthcare disparities in our communities and across our country. You all have been on the front lines. You are on the front lines of serving in healthcare, providing a range of services. And frankly, you are the experts. You are the experts and you are closer to it than so many other people, and have an opportunity to be at the table with public health community, with other healthcare providers, with safety net organizations, providing a variety of social services. And if you aren't at the table with them now, this is a time to jump in there. Jump in because you have a knowledge base, you have experience, and you can help to address the issues around equity that we're seeing across the country in terms of access to healthcare in general, but also access to COVID testing and care. The second thing is that you are experiencing most likely every single day, I mean, what it's really like to come face to face with this pandemic. There's a lot of people, because we have been emphasizing stay at home, shelter in place, and so forth. You have you are, I mean, by mission, I mean, we all, and we say repeatedly each day, we're here to care, we're here to serve and do no harm. And do no harm means we are going to scrap together as best we can in order to care for people and make sure they can get the testing and the care and still address everything from broken bones to UTIs and chronic pain. And so how do we direct those? So you all know you have the stories. And then the other matter is that we all are representing the faith community. We speak for and we speak among people of faith. And, you know, at Church Health, I don't know if our mission at Church Health is to reclaim the biblical commitment to care for our bodies and spirits. I don't know if there's ever been a time where that becomes so tangible, and that when we talk about spiritual care, everybody gets it, because there's a bit of a spiritual need and an emotional need that has come to the surface and needs to be addressed, not just with our patients, but with our partners, with our neighbors, and the people who provide everything from financial support to volunteering. So consider all those things and how you can, for lack of a better word, make the most of them, to leverage them, because I think then that you can have a voice and your position and your needs are going to stand out amongst the noise and and really be more accessible and more prominent when we all are dealing with scarce resources. Another thing to consider too is, and when we look at the different ways that you can fundraise and so forth, there are resources that are becoming available to support emergency needs, to support faith-based organizations, to really sustain those organizations that are on the front lines. And so while a month ago, some things may have been a little bit harder to reach, there's many more funds that are coming through community foundations and businesses and so forth. And while our small businesses and employers are struggling, there's others who are really pushing considerable resources out to the community and also willing to invest in organizations across state lines outside of their surface area. Even for Church Health, last week we, after many years of kind of considering there was really no need to subscribe to any kind of grant listing service, we broke down and bought a subscription to GrantWatch, because after all, you never know when you might find something that's a perfect fit that you wouldn't have found through Google searches or your regular research for emergency or healthcare funding. So with that, I mean, I think that all of those things, I mean, these are days when we say, I'm glad I'm not representing an arts organization. I'm glad I'm not fundraising for a park, because I think that a lot of those organizations don't have the same kind of role that we have, and understand that you can play to those strengths and you can be a voice, a storyteller, and really create some vision for how we can provide immediate care, but also keep our engines running. Okay. All right. So there are, so I think that there's several different things to think about when you're fundraising. And some of this is probably things that you've already heard me say or you've considered many times before, but I want to emphasize two things. First of all, I think this is when it's so important to be true to yourself, authentic to your organization. This isn't time to necessarily try something new or create a new identity for yourself. Being consistent with the voice that you've used and the message that you've conveyed is so important, but you're putting it into a new context. The other thing you may want to consider is also how you can, coinciding with the sort of position of strength you have right now, where can you sort of nudge your way in or create a place at the table or even within your local media and your in the local landscape of where the conversation's taking place, so that your patients, your partners are being represented. I had a call, I mean, literally going back to like the second week of March, which seems like an eternity ago, right? Where I got a call from a newspaper asking, who's speaking for the underserved, people who are undocumented, people who don't have insurance and so forth. And I think you can be that position. And so that's going to raise your visibility, but also attract others or help others find you, whether they need care or whether they want to support your work. And then likewise, it's a balancing act, but I think it's an opportunity to be bold, to be forthcoming about the realities, but it's also important to be humble and also create ways or think through ways, what can people do to help now? Because at the end of the day, there's a lot of people who are at home, a lot of people who are used to just getting together and mobilizing a group of volunteers. And unfortunately, we have to tell them all, stay put. I mean, I literally had a volunteer, she's been on our board for years. She wants desperately to provide meals to our frontline clinical staff. And it's taken 3 of us to tell her, stay at home, your husband is immune compromised, and we will make arrangements, bring you back to visit our staff and thank them in person later. So take advantage of those opportunities that people, and that's when we need to get a little bit creative. So Okay, I'm going to pause there and just see if there were any questions. If you want to just post them in the chat, or speak up if that is helpful too. Any questions? No? Okay. So I will keep going. All right, so in terms of fundraising strategies, there were several different things that I wanted to recommend. Some of this is based upon what we've been doing at Church Health, but it's also just in sort of surveying the landscape and seeing what other people are doing around our community and around the country. First of all, we immediately shifted into starting to call donors. We took our list of recent donors, broke it into several different categories, and have trained and assigned our staff to make calls, just to do what we've called affectionately wellness checks. But while we're not asking for funds, we've created a set of talking points, things where our staff and even volunteers could make phone calls, check on a person, thank them for the past support, and just ask them how they're doing. Ask them how they're faring in the midst of this crisis. It's been really interesting because some people do nothing more than say thanks and hang up the phone. So that call takes about 20 seconds. On the other hand, we've had many of our team members say that when the donor receives a phone call, that they've never actually had a personal call before, and proceed to have a 15-minute conversation. The goal here is to keep the connection going, to keep people informed, and to make them feel part of you, your mission, and your day-to-day work. It also can, and has in many cases for us, prompted the offer to help. And this is when you can't at all be afraid to say, we still need financial support. In fact, we need financial support more than ever. So having a list of suggestions for how they can help you might be a useful thing to do when making these phone calls. The other thing is that, and again, having a set of prepared remarks or comments can be a really useful way so that you have consistency across all the people who are making those phone calls. Another, and it goes without saying, that when you're making those calls, or when you're sending letters, or maybe when you're dragging out the list of, birthdays of people, keep track of all of those contacts, because you're going to want to know down the road, who was it we called, what was the status, and really having a solid record keeping system for that donor engagement. A second thing.
You know how this works?
Pardon?
Is there in there?
Yeah, there's $200 in there.
Pleading with them to try, because she's spy buying drugs and she knows y'all are going to get smart to that shit. You know? That's the problem.
Oh, okay. I think someone was having another call. So the second thing that I would recommend is putting together a really thoughtful letter to donors, or to neighbors, or to partners in healthcare, or all the above. Tell them, really speak, and I think what's so important is to not speak from the perspective of a weary or desperate leader, but really speak, again, going back to the position of strength. You are leading healthcare organizations. You are a person of faith. You have been trusted by countless people to fulfill a mission, and your work is so essential to the community now, more than ever. And so to speak from that position where you feel most comfortable, and speak clearly and authentically to what's taking place, what you see, but also even a story or a bright spot that shows that how you've made a difference, and where you've been able to find strength in the support of others. Now, to that end, this is a thing where, I mean, to really, maybe a matter of drafting the letter, setting it down for a day, and then revisiting it. Because I don't know about y'all, but I think a lot of people are on this a bit of an emotional roller coaster. But go to a place of honesty and authenticity. And I will tell you this, I've received several different donation letters from different organizations over the last week. They stand out because there is a lot less mail, and I don't know about y'all, but there's a lot less e-news coming from the nonprofit sector. And so this is where, I mean, people are reading things. I've never gotten so much feedback from a letter as I did 2 weeks ago when we shared this letter. And some of it's just from people saying, thanks for sending me some mail. So I do think that this is going to stand out. People are at home, they're reading stuff. And likewise, they want to stay informed. They want to know what's happening with the organizations and the people they care about most. The other thing is, with that letter, it is entirely up to you how you present the opportunity to provide or invite people to support you financially. But there's nothing wrong with remittance envelope that you stick into that letter. So while you're not saying it clearly and saying, but at least the impression, it gives the impression that financial support is welcome and absolutely needed. Another opportunity is to look at your electronic communication, your digital communication, whether it be social media, e-news, and even the use of video to provide periodic updates on what's taking place, how things are changing. I don't know about you, but here at Church Health, our operations have completely turned upside down. There's nothing that we're doing right now that's the same as it was on March 16th, March 17th. And we have closed clinics to preserve our PPE. We have cross-trained dental hygienists to run a drive-through COVID testing site. We went from 0% telehealth to what will soon be about 70 to 80% telehealth. It has been mind-boggling. And not to bore you with what's going on at our command central, what I think is important is that people want to know how organizations are adapting and adjusting. And so think about your posts, think about your e-news, think about even brief, carefully constructed videos to communicate so that people stay apprised and people feel a part of your day-to-day. The last thing is that I would recommend is even looking at just card writing. And this kind of dovetails with using volunteers. But once in a while, there are some people who will never pick up the phone, who will never respond to an email, but by God, they would love to see a card, that has your logo on it, that just says, thinking about you, thanks for your help in December, and so forth, and just keeping that stewardship alive. This is a great opportunity too for those people who want to help, want to volunteer. It could even be volunteer doctors who you don't want to put in harm's way. Perhaps those are some of the people who give them a list of 10 people and a script and let them run with that contact. But then also to that end, if they do send something for you, make sure that they do say John Doe, volunteer doctor, or Sarah Smith, community volunteer, whatever the role that may play, because again, it shows we're all in this together. Okay. So last of all, and as I kind of jumped into this already, let's talk about using volunteers, because this is, again, as I mentioned, there are so many people at home or in communities asking, how can I help? What can I do? And there are a lot of things they can do without having to come on site and without them having to take any real risk to their safety or the safety of others. So first of all of you have teams and other folks who are burning the midnight oil, gunning like crazy, trying to keep up with everything. And the last thing they're thinking about doing is packing their lunch or running out in the middle of the day to go through fast food. And so, if volunteers want to, or a church or the organization across the street has offered to help, don't hesitate to say, hey, we'd really like your help in supporting our frontline team or our clinical staff or our folks on site who aren't getting the breaks and somehow amidst all that are trying to homeschool their kids or take care of other loved ones. So enlisting people to provide meals either for your frontline employees or even look at how perhaps they can provide meals that would go to your patients. Generally speaking, just a couple little side notes on that. As we've done this, obviously there's huge issues around food safety and so forth. And so if you enlist a local restaurant and they provide individually packaged meals and they and you work with them for delivery or pickup, that way you can assure that the whole process is safe, no one's put at any increased risk, and your folks are gonna, trust me, will really appreciate that a little bit of nourishment in the middle of the week. Another suggestion might be enlisting your partners, your volunteers to help secure critical equipment. There is a abundance of need, right? I mean, for goggles and gloves and masks and so forth. While we all struggle with the global supply chain on these things, my bet is that there are people that you see each and every day who have a stack of gloves in their closet or masks that are sitting in, their garage. And, as the guidance from the CDC evolves, we know that even something as simple as a cloth mask made out of your, bandana from last year's Halloween costume can be crafted into something that's, at the end of the day, useful and better than nothing. I mean, we absolutely have to have medical grade equipment for those frontline folks who are coming face to face with COVID or other respiratory and other illnesses. But in the meantime, when you're talking about folks who are just coming into the office but still need protection, handmade masks, other lesser stringent equipment can be very useful. And that would go with even like hand sanitizer, all these different paint gowns and so forth that might be needed, not just in the next few weeks, but really in the next several months as we continue to battle this out. I got tickled too because there were, if there have been a couple efforts just literally in the last 48 hours where folks who are used to creating everything from apparel to prayer shawls have come forward and offered to help. And I need, or John or Marty needs to circulate a story about a couple of women who connected with someone on the procurement staff at Baptist Memorial Healthcare a couple of days ago in Memphis. And Baptist had found upwards of 20,000 defective medical masks in their storage that were not usable because they had broken elastic. To make a long story short, this procurement officer worked with a couple women, different congregations, and ultimately they have engaged upwards of 400 volunteers to fix these masks and then redistribute them to healthcare organizations and safety net agencies in a matter of a few days. So I think even CNN picked it up. But my point in telling you that is not about the media. It's the point is that there are people of faith who are mobilizing, engaging their friends, even jumping across different congregations in order to push so that you have the resources you need to keep your doors open and keep your folks safe. Last of all, there are, within congregations, there are a number of different efforts being made. And what I would first recommend to you, if you haven't done so already, is take a look at what Church Health has done recently to really galvanize action throughout the faith community. On March 17th, so 3 weeks ago, it's hard to believe it was that recently, it feels like forever. But we created something called the Memphis Clergy COVID-19 Response Initiative. Dr. Morris convened a group of clergy to do a webinar and a virtual meeting to really engage the faith community in crisis response. We have information on this network on our website at churchhealth.org/FCE, which it stands for Faith Community Engagement, but it's churchhealth.org/FCE. On that website, there are not only more than a dozen resources for faith communities in guiding them in their response and their support for their congregations, but also there's a link to a Facebook group that now actively addresses countless issues and promotes weekly webinars on issues of great urgency for communities of faith. The beauty of this network is that it literally encompasses communities of, of all faiths, but it gives folks everything from talking points about why we can no longer worship together, how can we create a meaningful experience using virtual services, but also how do we sustain food ministries? How do we minister to our members when we ourselves as clergy members are struggling? And there's a forthcoming workshop on how do you foster faith and spirituality among children during this crisis. So lots more there, but I highly encourage you to take a look at that because I think it might provide some insight and inspiration on how you can support your communities of faith. And also keep them centered on this broader need for health and health care and spiritual care. Last but not least, before I drop out and take some questions, I think what's helpful is that there are a lot of resources that are free to nonprofits right now, things that would ordinarily require a subscription, but now are being offered because the news is blowing up and because there's so many more resources. And so I would encourage you to look for those. The Chronicle of Philanthropy now has free daily updates on coronavirus. And so you can just subscribe to that and get that into your email. There's a website, a network, a national sort of resource center called Network for Good. And they have periodic workshops and white papers that are useful. The Council on Foundations has more and more information being offered. And likewise, I would imagine that many of your community foundations at the local level or at the state level are also in a position to keep everyone apprised of what's taking place, but also the opportunities for financial and in-kind resources. With that, those types of things, there's any number of opportunities that are out there. And I think too, remember to balance what your needs are right now in the midst of this, but also think too 12 months out, and as opportunities come up for things that under normal circumstances you would do, or outreach you would do because you wanted to do a special event in November, keeping those contacts alive, keeping people informed, because things will become normal again. And all those people, even those who just meet us along this rocky road right now, are going to want to stick stick with us.
Daddy, have you ever seen a car this full?
Okay.
I don't think I have.
All right.
Buddy.
So hopefully that was useful. Are there any questions? Anything
Question
else?
in the chat that just came up about whether this video will be available, and the answer is yes. It'll be in the Echo YouTube channel probably later today.
Okay. Well, I would imagine that John or Marty or Josh will take your questions if anything else comes up in the coming days or weeks. I do hope that everyone is getting enough rest, finding time for quiet, as well as for and just to really connect with your families and friends, whether virtually or in person. But I think all of the things that sort of keep us whole and keep us so forth are as important as ever right now. Okay, what websites for resources do you recommend? I would, what would be helpful? I've got kind of a running list of websites that I can share. Besides Network for Good, besides Chronicle Philanthropy, there's another call I was on yesterday. But let me, if that would be helpful, we can send a follow-up resource with not only the website resources, but also it looks like someone is about talking points, and I'd be more than happy to share our talking points too,
Have a good day.
which obviously are going to be adjusted for your needs and for the points that you really want to emphasize when making those calls.
Yeah.
Okay. And I'd be happy to share the letter. Yes. There was a, let me just write, I'm just writing notes to myself so I don't forget these things. And the talking points, sure. And actually, if it'd be helpful, I have seen a couple different letters that have very different tone, very different approach, both being effective. And so I'll share those with the group as well. Okay. Okay, someone asked, okay, so Campbell Aaron asked, we're having discussions about sending our annual appeal and what that looks like this year. Do we risk looking greedy to donors, maybe scale back and take the right tone? So everything that I've read, and even in talking to a couple of my counterparts at other organizations, says that if you have an appeal that generally goes out at this time of the year, still send it. But I think that the tone and the information is going to be very different than it would under normal circumstances. One thing too that has, where we've seen some strong results too, is also explaining what are some of the costs that you're incurring right now, so that people have some context for, like, what does $100 do? What does $1,000 do? What are the big costs that you're incurring on top of what you would ordinarily spend for your day-to-day operations and programs? So I would say go ahead and do your appeal, but coinciding with that, really making sure that it is as current as possible. Really speaks to speaks from a place of being able to educate major donors.
Here's some water, and here's some, Daddy, here's some water, here's some milk, here's some here's some protein bars.
One other thing, just since someone asked about talking points,
that's all
to also keep those talking points current. I created talking points for my team, I think on about the 18th, 19th of March, knowing that they were going to start making phone calls, and we've updated them about 4 times.
Can I call
It
you
was like,
now?
you know, when we
So
started all of
good.
this, we had no idea if we were going to even do COVID
Okay.
testing.
You can have me
This week we started a
Then
drive-through
not have
testing
me.
clinic that isn't just open to our patients, it's actually open to the community, which is really exciting and super uncertain at the same time. And that was even announced in our local paper. So and how we inform people, making sure too that those who are making phone calls at least know how to find information if questions surface so that donors can get answers right away. Okay. All right. Well, I know you guys are super, I really admire all of you for your leadership and your drive and your passion. And I know these have been difficult and exhausting days, but I think that the silver lining is how many opportunities have become available and how we can all take advantage of this network and the expertise at others so that not only do we stay sane, but we can provide the same level of care for the people who depend on us. So I guess this is also to when we're all grateful that we do have our faith and the support of other people of faith so that we can do our best work and keep perspective even when things get a little dicey.